difficult time. I also would like to ask that, you know, we continue to keep others in prayers that have been impacted directly or indirectly by this coronavirus, COVID-19. So let's continue to pray for one another. Let's continue to serve one another. Let's continue to love one another. When I think about Prince George's County and all the people that live here in Prince George's County, we know that we're a community of love and service. And so we will get through this together. We will get through these difficult times together. And throughout this coronavirus shutdown, the county executive, also Brooks, and the entire Prince George's County Council have been working very, very long hours during these difficult times, and to ensure that the essential services are there to support the community's needs during this pandemic. The entire District 9 team and the entire Prince George's County Council, we are here for you. We support you, we support your families. So if you have any questions or if you need anything, we're always a phone call away. Please call us, please, because we're here for you. Do not hesitate not to call us. We want to be able to be of an assistance for you. I want to thank the Vice Chair of the Prince George's County Council, Calvin Hawkins. He's also the Chair of Health and Human Services and Public Safety Committee. So I want to thank you, sir, for your leadership. I thank you for all that you've done over many years in this county. And we are truly blessed to have your leadership in our community. And so for that, I say thank you. And me and Calvin, Councilmember Hawkins, we're good friends as well. And I always call him the people's champ. And so we appreciate you. But let's, as a community, let's continue to pray for one another. Let's continue to practice social distancing. Let's continue to wash our hands. And let's continue to wear our masks when we have to go out to get our essential things that we need, like in the grocery stores or go to the pharmacists or the doctors. Let's continue to be good stewards in our community and protect and love one another. Thank you so much. I appreciate everyone. I appreciate all that you've done. I appreciate the entire District 9 team and Councilmember Hawkins' team for actually organizing and putting this together. And for that, we're grateful for your service. Thank you so much.
Thank you, Councilmember Harrison, my good friend of long standing, for this opportunity to share with you in this very important meeting. You've said it all, and I could just remain silent so that we can hear from those who you have invited to stay on this, to participate in this call. So I will be very short and just say this to those who are listening. Thank you for coming, and thanks for all those who are on the front line trying to mitigate this virus called COVID-19. Prince Georgians, we're at a place that we're in one of the most challenging times of the 21st century. It's challenging because we're dealing with an invisible epidemic that we have no idea how to contain it, how to cure it, but I believe our medical people will find an answer. But I ask you in closing to keep on the battlefield fighting, remain Prince George's proud, remain united, and we will rise together. I say to you that this is a challenging moment because we're in the 21st century and we've not seen anything like this. Generations of Prince Georges to come will look back on this moment and say, while it was challenging, it was our finest hour because we lived up to the challenge and we saved lives by doing what our medical expert has asked of us. So enjoy, learn something tonight, and thank you for giving us your time by listening and participating. Thank you very much.
Thank you so much, Council Member, and good evening all again. My name is Ashley Sharp, and I'm a member for Councilmember Hawkins' office. Tonight, I will be helping to facilitate this virtual town hall, and I would like to start with the agenda. Please note that all attendees, whether you're tuning in through Zoom or by phone, if you're tuning in by Zoom, you'll be able to submit a question through the chat box near the bottom of your screen, and our staff will try their best to capture as many questions as they can in order to relay them to the appropriate panelists during the Q&A portion of our town hall. We're joined tonight by hundreds of residents, so if we do not get to all of the questions, you can also email them to the email addresses that were listed on the flyer. This webinar is being recorded, and we will begin with discussions related to COVID-19 and public health among our medical professionals, moderated by Dr. Yolanda Hancock. We will then transition into a short briefing about the 2020 census from the Office of Community Relations, during which you'll be able to participate in a short and interactive anonymous poll. And finally, we will begin by asking the questions that you all have submitted through the chat throughout the duration of the evening relative to the following areas: unemployment assistance, who will be supported by Mr. Bryan Moore; COVID relief for small businesses, supported by Mr. John Mason; public safety, who we're joined today by Major Dickerson; and also public schools, who will be joined by the local school board member, Sonya Williams, in the next few minutes. They did have a school board meeting this evening. Without further ado, Dr. Hancock, would you like to take it off?
Yes, my love, thank you so much. Good evening, everyone. I want to first extend a thank you to County Council Vice Chair Calvin Hawkins and to District 9 County Council Member Sydney Harrison for creating a community-focused platform to discuss COVID-19. I also want to thank my colleagues who are out on the front lines, who took time away to come and connect with the community in order to answer their burning questions. The first thing I want to do is introduce the panel. First is Dr. Terrence Fulham. He serves as the liaison to the County Council when they sit as the Board of Health. To Dr. Chile Ahagotu, who is the President of Medical Affairs for MedStar Southern Hospital, and to Ms. Sonya Bacchus. She is the Chief Executive Officer for Greater Baden Medical Services. We're going to start with Dr. Fulham. Dr. Fulham, when you sit as the liaison for the County Council, as they sit for the Board of Health, can you please speak to the county's response to the COVID-19 pandemic?
Certainly can. And first of all, let me say thank you, Dr. Hancock, and the council members, Hawkins and Harrison, for inviting me to be on this town hall, on this panel. I'm a Prince Georgian, live in the county, and so the county is very dear to me, and the health of the county is a very strong concern of mine. So we knew that the pandemic was coming. We all know that it started in China and made its way across Europe and hit Washington State and then made its way across the county. So our state and county officials were, in my opinion, ahead of the game in making the appropriate recommendations to the county. And I believe the county responded appropriately. And it's one of the reasons why we have a sort of a flat curve, if you will, to the infectious rate, and we'll talk more about that. But the social distancing and hand washing, probably the two most important things that we've done. This virus is a virus that we don't have a vaccine for, we don't have a cure for. It does have a mortality rate that's associated with it. And so minimizing the spread of the infection has always been the number one and the prime priority. We then progressed to the stay-at-home orders from our governor. And as difficult as that may be, that has had a significant impact in keeping the curve flat as we've seen the rate of the infections as they come across our county. And then finally, wearing the face mask, because we recognize the fact that the majority of those of us who may get infected with the virus may have little or no symptoms, particularly the younger adults. And so wearing that mask, if you happen to be somebody who is infected but has minimal symptoms so that you don't know that you have it, you're not passing or infecting anyone else when you go out to the grocery stores or any of those places. I think putting those in order and the county members and our community following those orders has been paramount to minimizing the spread of the infection.
Thank you. You also serve as the chair for Howard University's COVID-19 pandemic response team. Can you please speak to what the challenges have been for the county in terms of responding to the pandemic?
Sure. I think, the biggest challenge is, number one, we don't have a vaccine for it, right? So we don't know what our exposure risks are and what the penetration of the virus is. Number two, the amount of personal protective equipment is limited. And so how much we use and our burn rate is something that we're very, very concerned with. And that's been a big challenge for us. Also, the fact that we have to provide isolated beds and actually rooms that have what we call negative pressure to minimize the spread of the virus. Those are limited because when we built Howard University Hospital and a lot of these other hospitals, we weren't anticipating that there would be a pandemic. And so we have limited resources in that regard. So staying ahead of the surge, not running out of resources. And then finally, the testing aspect of it, the fact that we didn't have a lot of test kits available to us really kept us from being able to determine what I call the denominator or the actual prevalence of the infection across our county, so we would know where to put our resources and where to put our funding based on having a really good knowledge of how the virus is spreading.
Thank you for that. The last question for you, Dr. Fulham. Given the statistic that we just heard today, that the U.S. experienced its highest number of deaths in a 24-hour period of time since the start of the pandemic, although there are some that say we're getting ready to come out of this in terms of some of the orders, how would you say we're preparing for the surge here in Prince George's County?
So the big thing is to have the number of beds, and we've been expanding our beds. We've re-stood up Laurel Hospital, and we've been expanding beds. We've had tents that are being developed at the hospitals to really screen and triage those who are infected or coming in with symptoms, but maybe not so sick that you have to go into the emergency department or you have to be admitted to the hospital. So being able to separate that group limits the number of people that actually come into the hospital and have to be evaluated. The other thing is really staying ahead of what we call the burn rate or the utilization of our PPEs, our protective equipment, and making sure that we don't run out of that. And then the third thing is identifying through our modeling and through our surge evaluations, being able to guesstimate how many patients are going to actually need to be on a ventilator, because we want to make sure that we do not run out of ventilators. That's not a position that we want to be in where we have to make those kinds of decisions, who goes on a ventilator and who does not. So those are really the big challenges for us right now.
Thank you so much for your insights, but even more importantly, thank you for all the work you're doing on the front lines. I'm going to transition to Dr. Hagotu to talk about what's happening in the hospital space, specifically in District 9 and across the county. And I think Dr. Chile, there we go.
There we go. Thank you, Dr. Hancock, and thank you so much for the council members' invitation to this program. Just putting this on is key to making sure that our community continues to remain aware of the developments with this unprecedented event happening in our country. So thank you so much, and thanks for the opportunity to be here.
Thank you for joining us. My first question is, what has your experience been in managing the COVID-19 pandemic on the hospital level, specifically in District 9? We know that you're in Southern Prince George's County representing very, very well, and we just want to hear what your experience has been.
Absolutely, and thanks for that opportunity. MedStar Southern Maryland Hospital Center has embraced the challenge of fighting this global pandemic with all the resources available to us. We've planned out a number of strategies to expand out our capacity. Dr. Fulham articulated nicely the fact that one of the key factors in being able to stay in front of the surge is to have the capacity to handle patients who are quite acutely ill as they come in, and then they have a fairly protracted course even as they're recovering. And so having the physical and staffing capacity to do that is very important. And so we have put together strategies in MedStar Southern Maryland to do that. We've doubled our ICU capacity. We've also expanded our med-surg capacity and our emergency department capacity. I think the other thing is around testing capabilities and being able to quickly and broadly test patients to, one, ensure that we're identifying those folks who need a certain level of care, but also to get a better understanding of what the actual prevalence is of this newly diagnosed condition.
Thank you for that. And you've touched also on some of the challenges as well. One of the other questions that I want to ask, a death rate of 7.8% was recently reported out for MedStar Southern Maryland Hospital. Can you speak to how testing and severity of symptoms may affect that rate when we compare it to our state rate at about 3.4% and our national death rate at 4.8%?
Absolutely. And so when we look at case fatality, as again, Dr. Fulham pointed this out, you're looking at the number of deaths over the number of diagnosed cases. And so that denominator changes rapidly, and the rate of the change of the denominator changes differently than the rate of change of the numerator. And so there are three main factors that will drive the fatality. As you approach the surge, towards the crest of the surge, when you're really having a lot of acute patients coming in, you will see your fatality rate go up. But then as you move towards the back end of the curve, then you get a better sense of what the true fatality is in the cohort or the population that you're looking at. Another factor is hospital fatality versus population-based fatality. So if you're looking at numbers that are just in the hospital environment, remember, those are just the patients that get admitted to the hospital. And so if you don't have the rest of the population to include in that number, you can look at numbers that are relatively high. And then the other thing is the broad access to testing. And as we know, there are certainly some challenges that we started off with as we dealt with this pandemic and having access to testing. And as we ramp up our testing capability, certainly we expect those numbers to come down and look more realistically. At Southern Maryland, we started doing in-house testing about a week ago. And so we have about a 2-hour turnaround with our test results for our inpatients and our ED patients. And then we also opened up a testing facility for the community down at the Brandywine campus, which is right down the way, and it's free testing. So we know that as we expand our testing capabilities, we'll get a better, more realistic look at what the fatality rate is in Prince George's County and at our hospital.
Excellent. You guys are doing a phenomenal job in providing service to Southern Prince George's County. So I want to thank you for the work that you guys are doing, but specifically for the work that you're doing on the front lines as well. I'm going to transition over to Ms. Bacchus, who is the CEO for Greater Baden Medical Services, to speak to the primary care needs in the midst of the pandemic. Hello, Ms. Bacchus, how are you?
I'm doing well. Thank you, Dr. Hancock, and also Councilmember Harrison and Hawkins. I really appreciate you allowing Greater Baden to be a part of this. We're deeply grateful for your longtime support of our organization and certainly to include us tonight.
Excellent. My love, can you describe for us the role of a federally qualified health system like Greater Baden in tackling the COVID-19 pandemic?
Absolutely. First, let me tell you what a federally qualified health center is. A federally qualified health center is a nonprofit primary care outpatient health system that provides primary and preventive care to our community, with community being the operative word. All of our locations are located right in the heart of the communities, and not on the outskirts and in the suburban areas. we are right in the heart of our communities. And we also serve a number of what's called underserved patients in medically underserved areas. So we are serving folks who are generally, in most cases, at 200% or less of the federal poverty level, and many at 100% or less. So we serve the most vulnerable patients in our communities.
Thank you so much for that. As you already know, in your position, when we see higher levels of unemployment as a result of COVID-19, and with health insurance being linked to employment here in the United States, what do you think is needed to provide expanded services in the capacity that Greater Baden has to allow more people to access care?
For FQHCs, as we're known, we really thrive on patients who have primarily Medicaid and uninsured patients. We get some federal funding for our uninsured patients, but it's certainly never enough. So the areas that we most need support is help with caring for our uninsured patients, and any expansion of Medicaid, any expansion of Medicare, and certainly the Affordable Care Act plans that are still available in Maryland are hugely important. And we're grateful that we have some expansion of that through June, so that we can help our patients and those seeking care in our organization to achieve having some level of health insurance. One of the things that's really special about FQHCs as well is that for folks who are uninsured, and we know that now there are many newly uninsured individuals in the county, we are able to serve them on what's called a sliding fee scale. And with that sliding fee scale, there's an assessment done of their income, and based on that income level, that determines what their actual out-of-pocket cost is, which can be as low as $20 based on where they land on the federal poverty level and their family size. So, but helping to bridge the gap for uninsured is a huge piece of that. And I have to tell you all that Dr. Carter is always on the front line, standing up, saying that we need help with to care for the uninsured. So he's an avid person in the county, along with our council members who advocates for us.
He's definitely a staunch advocate to make sure that everyone has access to care. But thank you for that. My last question to you, my love, what partnerships have you or do you envision pursuing within the county in order to meet the needs of our most vulnerable populations?
So there are a number of partnerships that we have begun to have conversations about. Our friend, Dr. Ahagotu at MedStar Southern Maryland has been very gracious as we have had conversations prior to COVID-19 and since in relationship to how we can work together to best serve the folks of the county, particularly on the southern end. And so we are, hospital partnerships are very, very important to us. For one, FQHCs keep a lot of folks out of the ED because we take care of them where they belong in their primary care medical home. Another area is in the area of our senior care. And of course, Councilman Harrison and his team and I have been talking a lot lately about that and how we can really start to do some special things for the seniors. And so in those partnerships, we're looking at how we can provide more telehealth visits to the seniors in the area. And we're a community health center, so we serve what's known as kind of cradle to grave. We serve from newborns all the way through however many years a person can live. And so, so those are all important. But that senior population, which is the largest population, or close to the largest population in the country now, and a large population in our county, is very important. And we're looking at how we can expand some of those opportunities as well to fully support that group of citizens in the county.
Excellent. Thank you so much, Ms. Bacchus. I want to extend huge gratitude to all of the health experts on the panel, not only for your time today, but also for the sacrifices that you guys are making. I know that we're wearing a lot of hats, and the fact that you have cut out some time to spend with us and speak to the community it's so valuable. I've been asked to speak to the public health components of COVID-19. I think that a lot of people are now aware of the term health disparities. It's near and dear to my heart since it's actually why I went into medicine, but we are now seeing that communities of color, specifically Black and Brown people, are disproportionately affected by COVID-19. As a perfect example, within Prince George's County, we make up the largest percentage of African Americans within the state of Maryland. We also make up the largest percentage of people with COVID-19 infection and the largest percentage of population who are dying from COVID-19. African Americans make up 25% of COVID-19 infections and nearly 20% of the deaths within our county. So it's important for us to recognize not just the health disparity related to COVID-19, but the health disparities that drive the disproportionate number of African Americans and Latinx communities that develop COVID-19 and then die from it. And those factors, the social determinants of health is what we call it in public health. It's the factors where you are born, grow, learn, live, work, play, and age that drive our health outcomes. And with pride, I can say that the County Council has prioritized health, the incorporation of health in all policies. A great example of that is the second RAND report that's looking specifically at health and human services in Prince George's County. That should be coming out later this year. The work that I have done with District 9's county member, Sidney Harrison, he has done a phenomenal job. When he first got into office, his first ask to help make policy decisions was district-specific data from the health department, which had never been created in that way before. So the fact that he now has District 9 specific data to help drive those health policies allow him to recognize that his district is the district most affected by cardiovascular disease. They have the highest number of low birth babies and a significant decrease in terms of the mental health professionals that will provide care when we come out through this COVID-19 pandemic. We know that in his district, the majority of emergency room and hospitalizations are based on mental health illnesses when you compare that to diabetes and high blood pressure combined. So COVID-19, the presence of it just reaffirms the need for information and data so that we can direct efforts appropriately. For Vice Chair Calvin Hawkins, he's been equally as passionate about incorporating public health in his decision-making. As the chair of Health and Human Services, he has asked for public health insights from myself and from Dr. Fulham as it relates to issues like juvenile justice, returning citizens returning from incarceration. And an issue close to home for him, the disproportionate number of African-American women dying from breast cancer. And they're using that same health prioritization in terms of their approach to COVID-19. It clearly demonstrates a need for all hands on deck. It can't just be the healthcare professionals. In Prince George's County, our response includes our politicians, it includes our educators, it includes all community leaders, inclusive of our community. But in order for us to be able to do that, we have to do something very important, which is making our voices known and making sure that we are counted. And with that, I'd like to turn it over to Thomas Johnson, who will speak about the 2020 census.
Awesome. Thank you so much, Doctor. I appreciate that. Thank you for speaking and allowing me, first of all, Councilmember Hawkins, as well as Harrison, thank you for allowing the opportunity to be here to address the community. It is so important. And as we are now dealing with this COVID-19 crisis, it is more important than ever that we take hold and responsibility of our future. In the past, in 2010, the county lost $363 million in the census because we did not complete it. Now, that wasn't everyone, but that was a large amount. And so now there is a push from the county exec's office to the county council to all of our agencies, entities, to really key in on the importance of the census. So what I did was I put together a little presentation for you all, and I'm gonna let you all kind of share and see what's going on. from our point of view here. Bear with me, I'm pulling it up. All right, so let's go ahead. So first of all, we're here again for this virtual town hall. I want to recognize my director, Ms. Unisha Davis, also Deputy Director Derek Davis, for doing an amazing job during this time of COVID-19. This is our time as a county and as District 9 to step up and to really understand why this is important. So the impact of the census on the southern Prince George's County. COVID-19 is a disease caused, as we know, a recent respiratory virus. And we know that it has been attacking thousands of people, just nationwide, worldwide. So, and how does participation in the census impact emergencies such as COVID-19? Well, let's look at those ways. You have healthcare. There are vaccines that may be a portion to each county or city or municipality due to the count of people that are there. If we do not have the accurate census data count, then those vaccines that we may need may be short. Also, with census data, there is $675 billion in federal funding, which helps our local community. And it helps to fund our roads, our infrastructure of our roads, our schools, our hospitals, our Medicaid, and many other social and emergency services for children and families. During this time, more than ever, we realize now that our schools are closed, the impact that it has on our children, the impact, as we heard the doctors talk about, on our hospitals, on our Medicaid, and then those other services, those frontline workers that go to their jobs during this time while they're asking us to stay home so they can keep us safe. We need funding. And this is one of the ways that the county, that this area of District 9 can step up and show that they are Prince George's proud. And it doesn't take much time to do it. Now, here are some numbers of census information that I would love to share with you. So last Wednesday, on the 8th, we were at 46.8% in the response for Maryland, for Prince George's County. Now, for today, 4/15, we are at 49.5%. Now, our goal as a county is to get at 85% and beyond. But I have to be realistic with you all. If any of you all are like me, we miss sports. I love sports. I love everything about sports. And I try to equate this time as a team of individuals, right? So you have different areas in the county. Say we have District 9, 8, 7, 6, 5, 4, 3, 2, and 1. So we're all on the same team, Prince George's County team under Miss Angela Alsobrooks. But the numbers that we put up will determine how well we do in the game. Right now, we're at 49.5%. Our goal is 85 and above. There are some areas that are not doing as well in this game, and we need to increase our numbers. It is important that we work together because the end-all goal is to make sure that once we are coming out of this, that we have funding where we can fund things, where we're not going into higher taxes or we're not going into reserves, but we have money that is able to help us rebuild the whole country, but more specifically, Prince George's County. Now, as I show you here, you see a color map of stats that you can see. The darker the area is, the better in the county that that place is doing. The lighter it is, then the less that they are doing. Now, if you look in District 9, right now, that area that you see that is highlighted in the bottom corner, that's an Eagle Harbor area, a Baden area, almost on the cups of Gwen Park area. That area needs to do better, right? Just like the other areas right above that. Again, lighter areas, they're doing okay, but as a team, we have to increase. So there are other areas that I point out higher up in the map that you can see that are darker blues, those areas are getting their counts out. Now, there are some spaces that you see on there and you wonder why they are a burnt sienna or a kind of dark orange color, right? Well, those areas in particular, that one big swath that is close to you in District 9, that's Andrews Air Force Base. That is a group quarters facility. And so they are being counted differently. So they count a little different than the other areas around there. And the other dark area that's to the north, that's College Park. As you all know, recently, all colleges and universities, all of the children have been told to go home. So the normal numbers that are counted there are not. So rest assured that the Census Bureau is working very closely with those different areas to make sure that they get the numbers. But more specifically, we need for those areas to be impacted by you, those people that have the power to complete their census. Now, this next map I show you is just a map, a different color map. And this is one you can also pull up online, but it shows the areas, right? And the ones that are of concern that we're really looking at is our Greater Baden, Akakeek, Brandywine, and Clinton. Those areas in the Eagle Harbor areas I spoke of, those areas, we really need to step up our census participation, because at the end of the day, the goal is to get as much funding as possible, because when issues arise like this, we need to know what to do. So I'm gonna make it easy for you, right? I'm literally gonna walk you through the process of completing your census. It's as easy as this website. The website is www.census.gov. And what I will do is I'm gonna click on this link, and then I'm going to open up another page for you so that you can see exactly what I see. Bear with me. I'm gonna open this up here. Let's do new share, and I'm going to, here we go, and boom. So I'm gonna open this one full screen, and here you have the census page, www.census.gov. It is easy to get to. Now, this area right here, the 2020 census is happening now. Respond today. Tap on this link. And as you tap on it, it will open up. And it says, shape your future, start here. You click on there to respond. And then right there, it will pull up your census questionnaire. It is as easy as that. Literally, I have a family, I have 5 children, and my wife and I, it took us literally 9 minutes to complete this census. Realize that this census is safe, it's easy, but it's even more than that, it's important, especially during this time. It is so easy, there's no personal information on there. And if you have already done it, celebrate. But make sure you tell others. Tell 3 others, 4, 5 others, because it is that important that we do it. I want to show you here that if you are looking to complete this census, there are 3 different ways, and it's very simple. As I spoke before, you can go to www.my2020census.gov. And also, I have something else for you. And this is something that is just information, but the sooner you complete the census, the better. You will be able to complete this now online. Due to COVID-19, you are able to complete it now as late as October the 31st. Now, I'm definitely not saying please do not wait until that time, but I'm telling you it's going to be open that late. Now, if you're a person that may not have the internet, but you want to call and speak to someone, the number is 844-330-2020. That's our English number. Also, if it's Spanish, it is 844-468-2020. Now, there are 16 more languages available. If someone needs to call, and many more languages, but if someone needs to call, all they need to do is request, and they'll be able to put them through to someone who will be able to help walk them through the census. Now, lastly, this is also available by paper. You can get it, it will be mailed to you at least twice during this time so that you'll be able to have it, to complete it, and you can mail it back. But it's very easy to complete. If you can do it online, they're asking people to do so. If you can do it by phone, do so. If paper is easier for you, please do so, but be safe, right? Because we want all of our community members to be safe. Now, the goal is with District 9, let's show the county that District 9 is proud to be counted. That is the slogan for the census. So if you have completed your census already, yes or no, make sure you take that vote. Have you also told someone else about the census? If no, then make sure the next time you hear a conversation and you see that tallied up, you can be proud to say that you did tell someone about the census.
Thank you.
Again, and it's something that we are able to for generations to come. So thank you for allowing me to speak tonight. It is my privilege and honor, and let's get counted, everyone.
Thank you so much, Thomas. The results of that polling that you all just now participated in were actually very positive. 89% of the attendees on this call have actually already completed their census. And 77% of those who did complete their census has told at least 3 of their neighbors, friends, or family members. So it looks like we have a very engaged group this evening, and we are very excited about that. But before we turn back to Dr. Hancock to continue to review your questions that you all have been sending, I did want to remind everyone that you can continue to post questions in your chat box, because we do have these other great panelists that you all see here. We were recently joined by your local school board member, Sonya Williams, who is waving. As I mentioned, she just finished her Board of Education monthly meeting, but she has joined us and will be able to speak to anything education or public schools related. And again, we'll go back around and just have a quick introduction from the panelists who have not yet spoken, and just tell us your name and what agency you're representing. So we'll begin with Major Dickerson.
All right. Am I coming through now?
Yes.
Okay. Good evening, everybody. I'm Major Cedric Dickerson. I'm the commander of the District 5 Police Station here in Clinton, and I am with Prince George's County Police Department.
Awesome. Thank you. Mr. Mason, would you like to introduce yourself?
Yes, good evening, everyone. My name is John Mason, and I am a business development director with Prince George's County's Economic Development Corporation. And we are definitely a business advocate, supporting all those businesses that have been adversely affected by the COVID-19. And we're here to answer any questions you might have before and after this forum. Thank you very much, Councilman, for pulling this together. And it's critically important that we stick together and weather the storm. Thank you.
Thank you. Sonya, did you want to say hello?
Good evening, everyone. I'm Sonya Williams. I'm the school board member that represents District 9. And I'm happy to be here and happy to be a part of this effort that our council member has put together. It is so important that we continue to work together, and we appreciate our parents who are stepping in as teachers. And if there's any issues regarding technology or something that has to do with grading, feel free to shoot me an email, and you can find my email on the pgcps.org website.
Thank you, Sonya. Bryan?
Good evening. My name is Bryan Moore. I'm the Deputy Assistant Secretary with the Maryland Department of Labor's Division of Unemployment Insurance, and I'm here this evening to answer any and all questions from the participants in tonight's panel. I want to thank the organizers of this evening's forum for putting on such a wonderful forum and an opportunity to educate and inform the citizens of Prince George's County. So I'm happy to be here to answer any questions.
Thank you so much. So those were also the other panelists that are joining us this evening, again, who will be able to speak to the areas of unemployment assistance, COVID relief for small businesses, public safety, and public schools. And with that, we'll hand it back off to Dr. Hancock.
Thank you, my love. So we're going to address some of the health-related questions first. I've categorized them by clinical questions, county response, statistical questions, and post-COVID recovery plan. I will present the clinical questions to both Drs. Fulham and Dr. Agotu so that those questions can be answered. The first question that we received was, why hasn't Maryland or Prince George's County explored the efficacy of interferon alpha as a vaccine? It is currently being used in China and promoted by Cuban doctors all over the world.
So I don't have a lot of information regarding the alpha interferon vaccine. I know that we are looking at several vaccines with several of our industry partners. Johnson & Johnson is one. Dr. Igotu is probably familiar with some others, and hopefully something will come through soon. I'm not aware of anything that's been seen to be efficacious enough for us to start any type of beta trial or trialing on humans. But maybe Dr. Igotu has some other information.
Thanks, Dr. Fulham. I actually don't have a whole lot more to add to that. Only that, vaccines are still in the development phase. I know that there's been quite a bit of progress. Interferon specifically would not be a vaccine. It could be used in enhancing an immune response, but it's in itself not a vaccine. There is, for those interested in getting more involved, I believe the governor has launched a state registry for folks who have successfully recovered from COVID. And so that would be an opportunity for you to participate in that registry because the information that we get in terms of how individuals who have had COVID recovered, and maybe even some immunological information about their recovery could be helpful in accelerating the development of a vaccine. So I'm sure it's available on the state website in terms of how to get involved in that registry.
Yeah, and that's really important because in addition to that, knowing whether or not we're developing immunity to the COVID-19 virus is also important. We don't even know that. Actually, we're assuming it, but we don't know it. And so we'll be able to predict, resurgences and how we open up our communities to going back to being outside and doing some of the things based on our knowledge of our development of immunity for those who have survived and done well with the infection.
Thank you, guys. The next question is from Dolores in Clinton. My son has been on an internship in West Palm Beach, Florida, and is due home on Saturday. Is it recommended that he be quarantined from the rest of the family in the house for 14 days, even though he hasn't been exposed or had close contact with anyone infected with COVID-19?
So this is a great question. Dr. Igotu and I may have two totally different responses to the question. I think right now, for healthcare workers, we allow you to continue to work even if you've been exposed as long as you are asymptomatic. Dr. Igotu has a 2-hour test. So I would send him to Dr. Igotu, get the 2-hour test, it comes back negative and we're good.
That's a great one, Dr. Fulham. And I really wish that we had the capacity to test more people outside of our inpatients. In fact, even asymptomatic associates like myself have not been tested. But yes, I agree with you, Dr. Fulham. I think in a perfect world, we should be testing pretty much anybody who wants to be tested. But I think with some of the resource limitations we have, in this particular case of our caller, I would say that if her son is asymptomatic and has no known exposure history, that coming home is absolutely okay, and no special precautions would be necessary as long as, again, he's had no exposure history and is having no symptoms.
Excellent. Thank you both. The next question is from Isabella R. If you get a nostril swab at a hospital and the test comes back negative, they have recommended that you call your doctor to get another test to confirm. Is that the standard policy?
Dr. Fulham, you want me to take a stab at this and you can follow?
Yes, sir. You go first this time.
I'm gonna tee it up for you, my friend. So that's a great question. And there's been a lot of discussion about what's called sensitivity. That is the likelihood of the test coming back positive if someone actually has the disease. And obviously, we want tests with high sensitivity. What we do know of most of the products that have come online so far is that they all seem to have what we call very high analytic sensitivity. Analytic sensitivity just simply means that if the organism is identified or exists on the actual specimen, that the ability to, for that test, that assay to identify the organism is very high, almost 99%. But that's very different than what we call clinical sensitivity. And that's really what's important for the caregivers and the folks that want to know, do I actually have it? And that is a much more complicated problem because we really don't know what the true clinical testing sensitivity is for this test right now. It is dependent on the quality of the sample. So it's a nasopharyngeal swab, which means that you have to take this swab and place it all the way into the back of the throat. And if you don't do that very well, you may not necessarily get a good sample. And so therefore you could get what's called a false negative result. Also, if you do what's called the oropharyngeal swab, where you're placing it in the mouth to get to the back of the throat, there's been lower yield from that approach. So there's so many different factors that can lead to a false negative result. However, if you have someone that doesn't have symptoms and you do the test and it's negative, the likelihood of you having the condition is low. But if you have symptoms and you get a negative test and you're still worried about your symptoms, please talk with your healthcare provider because it may be beneficial to get a repeat test. But doing it routinely is probably not a good idea. Terry, what do you think?
I agree. And then on the back end, do we test once the symptoms go away? And again, pretty much the same answer. If the symptoms are gone and it's 3 or 4 or 5 days later and you're feeling really well, you probably don't need to test prior to coming back to work. Or it was probably a month ago, I would have had a different answer to that question.
Very good. I think that answers. Anne asked a question about false negative tests, which I believe Dr. Ahagotu has spoken to. And you also mentioned later antibody test. I believe Abbott has just recently come out with an antibody test, and Dr. Fulham spoke to that. And it's a question that James asked on the chat during the conversation. Next question in terms of clinical management is vitamin recommendations. I actually just recently spoke with the coffee club, the District 5 Coffee Club, just last week and talking about some vitamin supplements in terms of boosting the immune system. So I'm going to speak to that really quickly. The question was specifically asking what's the dose of zinc in terms of boosting your immune system. And based on evidence-based practice and pharmacists who are working in the nutraceutical space, the recommendation is to consume zinc at about 50 milligrams twice a day as an appropriate dose in terms of boosting the immune system. So that follows up a question that was asked earlier. The next questions relate to the county response. Arlene from Upper Marlboro asked, what is the county doing to protect child care providers at essential sites for essential workers? The problem is that we cannot secure cleaning materials, gloves, or masks. Where do we go for help? And I think this speaks to clearly county executive's order as well as Governor Hogan's order for folks in the restaurant space and really anyone on the front lines to have masks. What do we counsel these individuals to do in terms of protecting themselves?
So we have, I can start. We have that issue at our institution. And initially we had a very liberal leave policy for our staff and members who had children, and if they were not able to find child care services prior to coming to work, we're instituting a lot of teleworking so that they can stay home but still contribute and still receive a paycheck and continue to work. We've also looked for outsourcing some of those activities. So we were trying to provide and identify, but of course with social distancing and all of that's associated with that has made that very, very difficult. So that's something that we're still struggling with. I will say that, we're allowing those mothers or fathers to stay home with their children and trying to identify some type of telework possibilities or opportunities for them so they can continue to contribute, continue to receive a paycheck, and then still take care of the family.
Excellent. I know also that Councilman Harrison and the District 9 team have also been working with an organization called Masks for America, not only to help secure PPE for our healthcare frontline workers, but also for our bus drivers, our public safety individuals, and likely to include our caregivers who are working in that child care space. I'm going to transition it back to Ashley so that we can make sure that we open it up to other questions.
Thank you, Dr. Hancock. Before we move forward, I do want to take this time to acknowledge our special guest, Senator Melanie Griffith of District 25, who has joined us as an attendee on the call, as well as any other elected officials that have taken time out of their evening to join us. Thank you. The first question that I have will be for Mr. Mason. This question is from Belinda. I'm trying to find assistance for beauticians who are one-chair salons. They had to close. I've received some information regarding grants and passed that on, but if you have any other information, I'd appreciate it.
Certainly, that's a great question. And first of all, again, I'd like to say that the Prince George's County Economic Development Corporation, under the leadership of David Iannucci, is definitely on the front lines trying to help businesses to find those financial resources and whatever needs they might have to get somewhat shored up a little bit in light of what's going on. Small businesses under 500 employees, as small as 25, and even sole proprietors. And to your question from your viewer, there is a program that's called Paycheck Protection Program, and it's a SBA program. And actually, it has 2 tiers, and tier 2 is for businesses that are sole proprietors, single entities, and what have you. You can actually apply with the Paycheck Protection Program through SBA. You can call our office. You can look at our website at Prince George's County's Economic Development Corporation is pgcedc.com, and you can see all the details on that, or you can just give our office a call. You can call me or send me an email. I'll make sure my email is available to you, Ashley, so that you can get details. I think what's really happening is that there's a lot of information that's circulating out there, and it gets a little bit complex and confusing. So what we've done is we've put it in some semblance of order in the way of PowerPoint presentations and literature that we can send out so you can see systematically how you would apply for those programs. What are those websites? What are those links that you go to, so that you can go right onto those links and very quickly and easily apply for those programs. There's the SBA program. Secondly, there was a program that was put out by the state. The state pretty much ran out of money after the first couple of days. I believe they received 40,000 applications from businesses for a pot of about $150 million in assistance. But lately, Prince George's County, we're blessed in that we have our own what's called Economic Development Incentive Fund. And under County Executive, also Brooks' direction, we have earmarked some of that funding to go to small businesses in the way of loans and grants. For that viewer who is looking right now at your program, there is a $5,000 grant for a single business entrepreneur, small business sole proprietor, that if you supply the proper paperwork, you go onto the website and we can see that link, you can see how to apply for that. And in addition to that, you can apply for loans through the Prince George's County's Economic COVID-19 Assistance Fund that actually launched about 2 days ago. So you want to hurry up and get on that site, call our office. We have people that have become, I would say, deputized in our agency to become technical support. So our business development directors and all of our staff are really well versed in helping you navigate through those systems and that software to get it up and running. We have had a great response, have received lots of applications in the last couple of days. It's a very user-friendly system, the county system. So in answer to your question, short answer, if that's possible for me, is that there are a menu of programs, albeit state, federal, and local. It's just a matter of which one do you fit within, and we can guide you and give you direction on which programs that you would fit within.
Thank you. Thank you for that. And if it's okay with all of our panelists, we'll make sure that we send out contact information and websites to all the resources that we'll be talking about tonight. Our next question is for Major Dickerson. This is from Rico and Clinton. Please describe the do's and don'ts of the Maryland Shelter-in-Place Order and the County Executive's mandatory mask order. Under which circumstances will the police intervene? What are the penalties? And what am I allowed to do during the Maryland stay-at-home order?
All right, that's a pretty complete question there. First off, let me just start by saying that we are in challenging and unprecedented times as we deal with this pandemic and try to enforce this stay-at-home order. But just know that your police department, the Prince George's County Police Department, have been on the front lines, and we remain on the front lines to ensure that our community is safe and that we're protecting the safety and welfare of our community. So first, let me explain the governor's stay-at-home order a little bit. Just to go over some of the activities that are allowed. These will be considered essential activities under the order. We have examples such as obtaining necessary supplies for oneself, family, household members, or pets, such as groceries, supplies needed to work from home, laundry, and products needed to maintain safety, sanitation, and essential maintenance of the home and residence. Engaging in activities for the health and safety of oneself, family, household members, or pets, including seeking medical or emergency services and obtaining medical supplies or medication. Also have caring for a family member, friend, or pet in another household or location, including transporting another person or a pet for essential health or safety activities, or obtaining necessary supplies and services. Also traveling to and from one's place of business. Also traveling to and from an educational institution to receive meals or instructional materials for distance learning. We also have engaging in outdoor exercise activities to include walking, hiking, running, and biking, as long as they do not involve gatherings of more than 10 people. And we just want to encourage everybody that when they participate in these activities, that they practice safe social distancing, and that they're wearing their mask as well. Also, the activities included that are approved traveling required by a law enforcement officer or court order, traveling to and from a federal, state, and local government building for necessary purposes. Those are the main examples that I have listed for essential activities. Anything other than that, such as loitering or participating in large events, whether it's athletic events, that's obviously prohibited. So what we have done as a police department is we've taken on the posture of using arrests as a last resort for enforcing the governor's order. Our posture is when the officers are requested to respond to or encounter a situation that violates the executive order, we want to explain the executive order thoroughly to the persons once we arrive or we contact these individuals. We want to also advise these individuals of the conduct that they're participating in that violates these orders. And we also want to explain to them that we need them to comply to protect the public health, safety, and welfare. Now, once we take those steps, and if we still are experiencing non-compliance, then we will at that point explain what the charges are that pertains to this order. And if we do not have compliance at that point, then we're asking our officers to contact their shift commanders to receive approval for full custody arrest if that is necessary. But as I stated before, that is absolutely a last resort for us, because obviously the last thing we want to do is place more people in correctional facilities. So we are thoroughly encouraging everybody to comply with these orders. And I do know that there was a misconception among some people that when this order was first instituted, that it was an order that only took place or was in effect after 6 p.m. in the evening. So I want to make it clear to everyone that this order is in place 24 hours a day, 7 days a week until the state of emergency ends. So just be clear on that. As everyone knows, the county executive instituted an executive order today that requires people to wear face masks or some type of face covering when they are shopping in any of the stores or taking public transportation. So just be aware that we will be out there encouraging people to abide by that executive order. And we expect everyone's cooperation so we can all get through this safely.
Thank you, Major. Now I have a question from Marlene. Can you talk about, this is probably directed to Bryan. Can you talk about the work sharing program for employers needing to reduce time of some of the employees they have on staff?
Sure. Work sharing program, also known as the short-time compensation program. Essentially, the way work sharing works, the work sharing program is a layoff aversion program. So it's an effort to prevent employers from having to lay off their personnel if they are experiencing some challenges with their line of work. Maybe the industry is suffering or things of that nature. And so essentially how that program works, the employer will complete a work sharing application with the Division of Unemployment Insurance. We will review that application. If it's approved, then the employees who have been affected by the work sharing, what happens is their work hours are going to be reduced, their weekly work hours. So let's just say, to keep the conversation simple, let's say a person's working a normal 40 hours per week, their normal work schedule, and an employer decides to reduce their hours by 20% or an 8-hour workday. So their hours been reduced from 40 to 32 per week. That individual, that group of employees whose work schedule has been reduced by 20% will begin to receive unemployment insurance benefits that's equal to 20% of the full amount of benefits that they will be entitled to. So again, to make the conversation simple, the maximum benefit amount in weekly unemployment insurance benefits in Maryland is $430 per week. 20% of $430 would be $86, right? So that individual will receive $86 a week in unemployment insurance benefits while continue to receive pay from their employer at the 32 hours a work week. And that's how the program works in a nutshell. I can't hear you. I can't hear you. Can you hear me?
Okay, can you guys hear me now?
I can hear you now, yes.
There we go. Thank you, Bryan, for that.
If I can add for a second,
Sure.
I did not want to, I believe Mr. Mason had replied to the scenario of a beautician with a one-chair salon. That scenario, that employee, that person who's the beautician, for example, ordinarily would not be eligible for unemployment insurance benefits, but during this pandemic, the federal programs that's available now, she would more than likely be eligible to receive pandemic unemployment assistance that would be equal to the amount that she would be entitled to had she been eligible for the regular unemployment insurance program. Let's say it's the maximum amount is $430 per week. She would be entitled to the $430 per week for up to 39 weeks. In addition to that, she would be entitled to the federal pandemic unemployment compensation, which is the $600 per week that individuals are entitled to through the end of July. So between now or when she files and gets approved through the end of July, she will be entitled to the maximum weekly benefit of her pandemic unemployment insurance assistance plus the $600 per week. So that's another option that she may want to explore as someone who would be considered self-employed.
Thank you. These next two questions I'll combine, and they'll be for Ms. Sonya Williams. How are students in South County provided Wi-Fi connectivity to participate in virtual learning? What can a parent do to support the children's learning during this time?
Thank you for the question. There are several ways that South County residents can obtain access to the internet. If there is internet access available in your community and you do not have an account, then we have set up a means for those families to get either a reduced charge for internet if they're not on free and reduced lunch. If they are on free and reduced lunch, we've worked with Comcast to provide internet service for those families. If there is no internet access available in your community, and that is found in some of our areas such as Croom and Baden and those areas, then we do have access to Wi-Fi at our school locations. You can drive up and park and send work in and download work to your computer by going to our parking lots. If you have no access to transportation to get to a school during the day, we have set up opportunities for students to pick up work packets from different locations throughout the county. And all of that information is available on our website. If there is a particular family who needs additional information or need access to the links, I will share that with you so you can provide that. And what was the other question?
The other question was, what can parents do during this time to support their children's learning?
That's a great question. The first thing that we're asking parents to do is to stick with the schedule. We have provided schedules for each level of education, elementary, middle, and high school. Follow the schedule that's shown. Try to set up weekly meetings with families so that they can be aware and everyone can be on the same page. Some of our families are sharing devices, so we have to set up schedules for students to, get on their devices at the time that's allotted to them. So setting up family meetings so that everyone can be on the same page is very helpful. Go over the homework with the students, the lesson plans in particular. And then just keep current with what's going on, read to the students as much as possible, and also allow physical activity, allow them to go outside and expend some of that energy from being in the house all day long. That helps to relieve the energy and get them focused back on the work that's necessary. The other thing that we have for students that are in from pre-K 4 and pre-K 5, we have a television station that's set up for them so that they can see the lesson plan that's given, and there's no need for them to put that, to have access to the internet. Everything is on the TV for those families. So I can provide you with those links so when you send out the information, you can share with everyone that's online.
That would be awesome. Thank you, Sonya.
You're welcome.
And before I pass it back over to Dr. Hancock to close up on some of our public health questions, I do want to punt one over to Thomas real quick. There are a couple members who are having challenges logging into the census website. So if there are any residents who are finding challenges being able to complete their census, what's the best way to be able to contact someone to get some help?
So I did give out the number for the census. It was the 844-330-2020 number, and that is to complete the census. So the county, the Office of Community Relations has a phone bank that started, and their phone number, if they have any questions or concerns or anything about the census, 301-952-4729. And that will come to someone in our phone banking area, and they will walk through whatever questions or concerns that they may have.
Thank you. Dr. Hancock?
Yes, my love. So 2 last health-related questions. The first I'll actually answer myself. Frankie from Brandywine, Sheila D, and Veronica D, and Wade W all had questions about zip code specific data. The CDC as well as the state have recently released data. How do we access that information? If you go to the coronavirus.maryland.gov website, you'll be able to see coronavirus information based on zip code, county, and state. As of today, when I checked just a couple of hours ago, zip code 20744 was in the lead in terms of the number of cases with 139 cases. And the zip code 20772 is not too far behind at 137 cases. The other question related to racial reporting also is included on the same website. As of today, African Americans make up the majority of those with COVID-19 here in the county at 37% and nearly 40% of the COVID-19 deaths. Again, you can go to coronavirus.maryland.gov and we'll make sure to include the link. The last question, I'm going to punt over to my colleague who serves as the chair for Howard University's COVID-19 response team. Mary from Clinton asks, has a plan been devised or being formulated on how we will proceed once the quarantine in place has been lifted so that infection numbers don't rise once we're moving out and about again? Is there a plan to eventually identify atypically infected individuals not showing symptoms?
Mm-hmm. And that's the question. And I'm very interested in Dr. Igotu's response as well. The peak of the surge, when the models are all over the place, so it's very difficult for us to really predict the future and determine whether or not the quarantine will end in May or will it end in June. We have models that say it won't end until 2022. We had a model that said it would end, that we would peak in mid-April, and clearly it hasn't done that. And so that's going to be very, very difficult. Now, having said that, though, we, even at Howard, and I know at the official level, we are looking at what are some of the scenarios to come out on the other side and start opening up. And I think a lot of it has to do with exactly what the question said, is will we have at that particular point in time the ability to test so that we can determine who's still infected, who has immunity, so that we can be comfortable in coming back out. There's a lot of surveys that are out, and most people surveyed are not feeling comfortable about coming back out and joining large groups. Currently, most of the surveys are saying it's going to be 3, 6, 9 months before they're willing to go to a baseball game or a football game and those kinds of things. Where it is really pertinent is New York City, because 60–65% of those who live in New York City get to work through public transportation. That's the reason why the infectious rates and the death rates are so high, because it was very difficult for them to social distance. If you just think about New York subways and how many people are on them. And so it is a significant concern. We don't have the answer to it yet, but we're certainly formulating different scenarios depending on where we are with the ability to vaccinate, the ability to determine who has recovered from the infection, and the more information that we have about the communities, the better we'll be able to make the right strategy so that we don't have a significant resurgence. COVID-19 is probably going to be around. It'll probably be seasonal. So we'll probably see it in 2021 and 2022. But again, as I forget the term, the herd inoculation, meaning the more and more people that have the opportunity to either get vaccinated or have immunity to it, the less of a risk that the virus will be to the community.
Absolutely, that herd immunity is going to be critical until we can get a vaccine. Dr. Hagotu, would you like to provide some feedback as well?
Sure. I think Dr. Fulham summed it up beautifully, and I totally agree. It really, this is all going to be about how we can accurately estimate the prevalence in the community, in the population, and that's all about testing, access to testing, and understanding, as Dr. Fulham described, the herd immunity effect. And you know, what I'm hoping in a best case scenario is that, you know, we will have a broader access to testing, both for those who are symptomatic or asymptomatic, and that will give us a better sense. And hopefully, if there truly is a herd immunity response, then in the next cycle, because as we've heard, it's going to be around, the severity of the response will be dampered, and so hopefully we won't have the kind of picture that we're seeing right now.
Excellent. I'm turning it back over to you, Ashley.
Thank you so much. So with that, as I mentioned to you all at the beginning, we do still have a couple of questions that we still see coming in, and we will try our best to get those answers out by email, whether that's through e-blast or following up with the council member's office. At this time, we have completed our webinar. This will be available to, as early as tomorrow to be able to replay. But at this time, if there's any other closing remarks from council members Harrison or Hawkins, please feel free.
Hello, Ashley. I'm gonna yield. I want the vice chair of the county council to give some words, and then I'll give a couple words.
Thank you, Councilmember Harrison, once again for this opportunity to participate with you in this very important discussion. And thanks to all the panelists for all your comments and responses. I just want to say one thing in closing. I heard Dr. Hancock speak to it, and that is many of us who are of color, the communities of color, we do not believe, notwithstanding what the statistics state, believe that this is a virus that impacts our communities. The numbers show that they impact our communities. As I ride around the county and I see what I see, large congregations of people of color, I have to say to you, you're putting too many lives at risk. You're putting too many Prince Georgians on the brink of death. Stop what we're doing and listen. This stuff is real. There's no joke out here. And please help us help you. Together we rise. And I just want to say in closing, County Executive Alsa Brooks and her team, Dr. Ernest Carter and Director of Emergency Management, Ronnie Gill, along with Dr. Askew, you all have done a phenomenal job leading us to the point where we can get back to business as usual. It may not be the same, but we'll get back there. And I just want to say thank you to everyone. Prince Georgians, we're going to beat this. And again, this is our most challenging moment, but it's our finest hour because we're Prince George's proud and we all rise together. Thank you, Councilmember Harrison, and thanks to all the participants and to the staff of Councilmember Harrison, as well as those who work with me for an outstanding job. I'm grateful to all of you.
Thank you so much, Brother Vice Chair Calvin Hawkins, for all that you do serving in Prince George's County. As you know, you know, I want to be able to express to the community, we are going through some difficult times, some times that are uncharted waters for many of us. And personally, I have not been able to see my family for over 30 plus days. I miss my dad, I miss my mother, I miss my family, I miss my aunts, but I do pick up the phone, we do talk. I have a responsibility to make sure that I am practicing social distancing, that I'm putting my mask on, I'm putting my gloves on, that I'm washing my hands 20 and 30, 35 times a day. And I'm doing everything that I'm supposed to do. You heard the county executive also, Brooks, and Governor Hogan say, to be a hero, please stay at home. Please stay at home. You know, we have to look out for one another. We have to make sure that we're doing all that we can in our own lives to protect our loved ones. And so for that, I want to thank everyone who is practicing social distancing. And I also want to thank our healthcare providers, the doctors and the nurses that are serving in the ICUs all across the hospitals in Prince George's County and all across this country. And we owe them a debt of gratitude because they've been serving and saving lives each and every day. And for that, I know that I care about everyone in my district. I care about all Prince Georgians, and I want everyone to be safe. I want everyone to be healthy, and I want everyone to be well. And so for that, we have to take the pledge. Just like we're proud to be counted here in Prince George's County, we have to be proud to stay at home in Prince George's County. You know, we can't think that life is the same. Life has changed. And because life has changed, we must change. And the change starts within. And change works from the inside out. And so for that, I am taking the pledge to make sure that we're doing all that we can. I want to thank my council colleagues, and I have to, our chair of the Prince George's County Council, Todd Turner, and all my council colleagues that are serving are all across Prince George's County. We are talking every day. We are communicating with the director of the health department. We are communicating with the county executive. We're communicating with Dr. Askew, the chief medical officer for the county. And we're also communicating with Mr. Gill, Ronnie Gill from Emergency Management. You all, we need you. We need you, so please stay at home. Please wear your mask and please wash your hands. God bless you all, and we will see each other soon. Thank you.